This episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them as supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi. I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples in how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with the package. So somehow we have to really, really work with them. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, the show that it's about all that matters to you from a psychological perspective, and I interview the masters in the field of psychology and human development and bring them to you because I have had the honor of being with them and learning from them. And today I'm so excited to have one of my own teachers who I have learned so much from, Dr. Michael Yapko. Let me tell you a little bit about him. Dr. Michael Yapko is a clinical psychologist and a marriage and family therapist. He's internationally recognized for his work in clinical application of hypnosis, treating depression, and developing strategic outcome-focused psychotherapies. Dr. Yapko is the author of numerous books, including the popular Breaking the Patterns of Depression, Trance Work, and Introduction to the Practice of Clinical Hypnosis, Treating Depression with Hypnosis, Integrating Cognitive, Behavioral, and Strategic Approaches, Hand-Me-Down Blues, How to Stop Depression from Spreading in Families, Essentials of Hypnosis, and Hypnosis and the Treatment of Depression. He's a recipient of the Milton H. Erickson Lifetime Achievement Award in 2007, twice recipient of Arthur Shapiro Award for the Best Book of the Year on Hypnosis from the Society of Clinical and Experimental Hypnosis for treating depression with hypnosis in 2001, and Hypnosis and Treating Depression for 2006, and the 2003 Pierre Janet Award for Clinical Excellence from the International Society of Hypnosis, a Lifetime Achievement Award honoring his many, many contributions to the field. Thank you, Dr. Michael Yapko, and thank you for being in my show. Again, I've had another interview with you, which it just went viral all over my LinkedIn, and everybody was calling and giving me some response about how much they enjoyed your conversation last time about hypnosis. And thank you for coming back, and this time we're going to talk about depression.
My pleasure. Thanks so much, Foojan.
My own experience going to classes with you, I've taken 100 hours of hypnosis with you, and beyond just the hypnosis, I think that what you have taught me is a way of looking at how human being thinks, and the way that they think produces a lot of their emotions and behaviors, and from there they will, go into depression and anxiety and all of that. One of the questions that comes up for me and many of my clients and my colleagues is that, we've had more than 100 years of psychotherapy in Europe, in the United States, and around the world. We've had numerous theories that have worked specifically with depression. You yourself are an expert in depression. And we've had many, many years of the medical field trying to give us antidepressants, one after another, probably every month. And somehow the ratio of depression, it does not appear to be declining so fast with all of these treatments around. And in some countries actually have risen, not actually gone down, but it's been more. Can you tell me a little bit about what you think about that?
Well, your observation is correct, and in fact, depression is increasing all around the world. Every demographic group is on the increase. And your question is a legitimate question. If we learn so much about depression and we have these theoretically great drugs, why isn't the rate of depression declining? And I think the more that we've learned about depression, the more that we have learned that we have been so absorbed in the medical model, the view of depression as a disease. People who even compare it to diabetes have really missed the mark that depression isn't a medical illness. Depression is more of a social condition. We're never going to find the drug that cures depression any more than we're going to find the drug that cures poverty or cures racism or cures child abuse. The medical approach has been looking at the problem through the wrong lens. And in fact, my most recent book on depression is one that you didn't happen to mention. It's called Depression is Contagious. And I was looking at all of the literature from a variety of fields, from genetics to epigenetics to affective neuroscience to epidemiology, different fields that have all independently come to the same conclusion, that depression really is a social phenomenon. It's defined in social terms, it operates in social terms, and in plain language, what it really amounts to when I say depression is contagious, I don't mean in a viral sense or a bacterial sense, I mean in a social sense. And I think people know, even from common sense, that mood spreads. There are people who walk into a room and they instantly spread rainbows and sunshine, and inside of 5 minutes everybody's holding hands and singing Kumbaya. And then there's other people who walk into a room and instantly suck the energy right out of it and turn it into a black hole. Mood spreads. Outlook spreads, viewpoints spread, and the way that people are looking at life these days, the way that people are conducting their relationships, the way that we're responding to technology and how it's changing our lives is increasing our vulnerability to depression greatly. And I think that that's really the next thing that we're going to have to pay attention to, is moving away from trying to define it as a disease that we're going to have drugs to cure, and much more helping people develop the kinds of life skills that they're going to need to handle this ever-changing and fast-changing world we live in.
So when we look at depression from a societal concept, there are depressions that are very much situational, that some event happens and we go into depression, and then there are people who, it's as if they're part of their personality is just, the fiber of their being is almost depressed in that way, which has been more of a chronic and all day and an attitude and the view. And then we also have like bipolar, and we have some clinical aspects of it. But when you look at the dynamic of depression, it's not medical, let's not look at it from that perspective, and if it's a societal and a psychological concept, if you were going to explain the dynamic of a depressed person and how that gets created into their system, what would you say?
Well, no one escapes the force of socialization. No one escapes the power of families to shape perspective and cultures to shape perspective. And the kinds of things that you're encouraged to focus on, the kinds of things you're encouraged to believe, the ways that you're taught to view yourself and the world around you, are the things that make you the most vulnerable. It's why, for example, we see how the child of a depressed parent is anywhere from 3 to 6 times more likely to become depressed than the child of a non-depressed parent. And we know now it's not because of genetics, it's because of modeling, it's because of social learning. That every time this 2 or 3-year-old child asks his mother or father, why? Why, mommy? Why, daddy? Your answer inevitably contains what's called an attribution, an explanation of cause and effect. This is why we do this. This is how we look at this. This is the right way to look at it. And when you have a depressed parent answering that question of why, in very subtle ways and sometimes not so subtle ways, this parent is literally teaching this child how to explain things in ways that set them up to be more vulnerable to depression over time. And interestingly, when we look diagnostically at the people who suffer depression, most of the people who suffer depression don't just suffer depression, they also suffer a coexisting anxiety disorder. And the interesting thing is the anxiety and the depression do not have the same age of onset. Anxiety typically precedes depression by at least half a dozen years. So when we see today's children, the 8-year-old, 9-year-old, 10-year-old kids who are already anxious children, these are the ones who are at great risk for becoming depressed adults.
And I've also sensed with my own clients and as I've worked with them that the concept of low self-esteem also feeds the level of first anxiety and then the depression. It appears that as I've seen people who have higher self-esteem and then later on higher confidence, level of self-confidence, that on the other side they're not as anxious nor do they become that depressed. Do you also see a correlation with this?
Well, we can be much more specific than using a very general term like self-esteem. Self-esteem is actually, as it turns out, a very overrated concept. There are lots of people out there who have very high self-esteem who shouldn't. People who feel good about themselves for no real reason. People, if you walk into a prison, for example, you have people who feel great about themselves. They think they're wonderful, and they're very proud of the fact that they killed a couple of police officers. They have high self-esteem. They just happen to be sociopaths, antisocial personalities. So self-esteem doesn't mean you're a good person. Self-esteem doesn't mean you're a skilled person. All self-esteem means is you like yourself. So we can be much more specific than the general term self-esteem. We can talk about the people who have the kinds of social skills, the people who have the kinds of problem-solving skills, the people who are better at being able to differentiate when something bad happens. Is this about me because I did something wrong, or is this about circumstances? It's about the capacity to make better and more accurate reads of circumstances that happen in life. People who are prone to depression are much more likely to blame themselves when something goes wrong. People who are prone to depression are much more likely to think and speak in very overgeneral terms. Not just, this was a bad day, but taking it to a whole new level when they say, life is so rotten. And so we're looking at the kinds of thinking skills, or what are called cognitive skills. We're looking at problem-solving skills, the kinds of coping skills that give people the chance to say to themselves, I like the way I handled that, which then results in what might be called higher self-esteem, or conversely, they chide themselves and berate themselves for handling something badly and feel terrible about themselves. So as we move it from self-esteem to more specific things like coping skills, problem-solving skills, reasoning skills, critical thinking skills, those are the things that are going to increase or decrease somebody's sense of their own effectiveness.
So as I hear you, it's not just about whether they like themselves or not. The aspect of liking themselves is one thing, but also is it workable in the world, and can they achieve things, and then can they manage life?
Yeah.
And as
Does it
they
make
like
them a
themselves
better
but
person?
can't manage life.
Yeah. Does it make them a better person? You know, that's part of it, is we want people to not just like themselves, but we want them to like themselves because they feel good about and respect themselves for the way that they handle things. And the flip side is when you're constantly down on yourself and criticizing yourself because you don't like the way you do things, you don't like the way you walk or talk or handle things, you don't like your reactions to things, you don't like how you bring people down, you don't like how you handle your relationships, and you're constantly at war with yourself.
But to me, as I'm hearing it, it's a little bit as if a catch-22 concept, and please open this up for me more, because as I hear you, there's one aspect of it is if somebody likes themselves and appreciates themselves, they're not apt to put themselves down because they already like themselves, and then assumably that won't turn into a depression. The other side of it, I hear you, and you're saying just because you like yourself, you might be a narcissist or a sociopath, and just because you like yourself does not mean you're a good person. That I get. But does a narcissist or a sociopath also get very depressed or not because they're just narcissist or a sociopath? Or is the depression also catch them, or is it that relatively not liking yourself, putting yourself down, not respecting yourself also adds to this kind of a depressive mood, and then it becomes like a domino effect, and it becomes like a vicious circle that you keep doing the same thing and you create more of the depressive attitude in your life?
You know, when so much depression comes from people mishandling key situations in their lives, mishandling relationships, mishandling big decisions that they need to make, making bad decisions on the basis of bad moods and negative outlooks, that is certainly a reliable pathway into depression. You know, your question is a curious one. Do sociopaths get depressed? And interestingly, the answer is largely no. That they're not reflective enough, they're not judgmental enough. You know, part of what happens is if you care about what other people think of you, and you should, it's called social responsibility. If you care about your performance, you're going to evaluate yourself. Now the question is, how do you evaluate yourself? Do you evaluate yourself in very specific terms that are supportive, where your internal environment is positive, and even if you make a mistake, you can say to yourself, okay, I can learn from that and be better for having made that mistake? Or do you simply beat up on yourself and beat yourself into the ground and come to the conclusion that you're not worthy and you shouldn't try and do anything because you're just a failure anyway? And this is what I mean when I talk about what is called a global cognitive style in the literature, but in plain terms, the overgeneral thinking. Someone makes a mistake and one person says, I made a mistake and I can learn from it. Another person makes a mistake and says, God, why am I such an idiot? Two real different responses to making a mistake. One is much more global, much more damning and critical, and the other recognizes that people make mistakes. There's a chance to learn from it. It doesn't mean I'm stupid. It doesn't mean I'm a bad person. That they're more critical in their thinking, meaning more selective in their thinking, understanding that smart people can do foolish things. Nice people can do mean things. Sensitive people can do insensitive things. Nobody is one-dimensional. Nobody is smart all the time. Nobody is sensitive all the time. And how the kind of internal environment that you create for yourself is very important. It's why, for example, perfectionism is so closely correlated with depression. When people are perfectionistic, they're very self-critical. They create a very harsh internal environment, and it's hard to live up to perfectionism when nobody's perfect.
Absolutely. And then what I looked at, the perfectionism also came from the anxiety that you also talked about, which is the precursor to the depression. Right. And it seems like these two are hand in hand somehow, where the anxiety of what if creates some of that, and it creates that revolving door between the anxiety and the depression consistently. And then I look at if someone is what I say, beginning to go into a depressive state, what is it that they can see about themselves, and then what is the rope, in a sense, that they can get themselves out of it versus take the rope and hang themselves in it? It's just like there's a way to be able to monitor self and look at where am I going and how fast and in what way that I can shift this dynamic. Now, I know sometimes because of the societal concept, family, the society we're in, and all of that, that there's a situation that as long as we're in that situation, we might not be able to let go of our depression, and we might have to shift the situation in order to lift us off. And then sometimes all the situations are practically okay, and then yet internally my dialogue is of some of not gratitude and consistently holding myself down and everything else around me down. So how do I notice that I'm going down into the depression, and what ways can I get myself to pull back up?
Well, I'm a strong fan of prevention, and the opportunity to prevent depression is something that we can speak intelligently about. But what that means is each person needs to know themselves well enough to know what their vulnerabilities are. No one is immune to depression. All of us, if you're capable of a mood, you're capable of a bad mood, and you're capable of a persistent bad mood. But knowing what your vulnerabilities are, we talk about depression as if it is a unified phenomenon or a singular phenomenon. And the reality is that each person's quality of depression is different. Each person's pathway into depression is different. Each person's way of experiencing depression is different. And how one person experiences it may have very little to do with how somebody else experiences it. So it starts with a self-awareness of, for yourself, how do you know when you're starting to slide? For some people, what they most immediately focus on are the physical symptoms. So they notice that they're having more difficulty sleeping. They notice they're having more difficulty mustering the energy to go places and do things. For other people, it's not about the physical. For other people, it's more about the cognitive things that happen. They find themselves being more indecisive. They find themselves having a harder time being able to concentrate. For somebody else, they notice it much more on a relational level. They find themselves impatient and short-tempered with other people and irritable and getting angry a lot and yelling at people, or the other way they go is they withdraw and they stop seeing people and isolate. So I can go on, but the larger point that I'm making is each person's pathway into depression, what their particular vulnerabilities are, will be unique to them, and it's each person's responsibility to know for themselves, I can be with these kinds of people and thrive. I can't be with these kinds of people because they bring me down. I can work in this kind of environment where I will blossom. I can't work in this kind of environment. Now, a lot of times what happens is it's that lack of self-awareness that leads people to put themselves in situations where they just don't belong. This is not a place for you to be given your vulnerabilities. It's the equivalent of some people who don't know that they're not parent material until after they have 2 kids, and then they realize, I'm not really cut out to be a parent. Well, it would have been nice to know that before you had 2 kids. And so that kind of self-awareness is really a critical thing. The other part of what you were talking about is what's known in the literature as the internal orientation of depression. Depression drives people inwards. They get more self-focused. They get more self-absorbed. And they lose very often the connection to people around them or external circumstances. They stop reality testing. They stop testing whether what they're thinking is true, whether what they're thinking is accurate. And when I'm being somewhat facetious about it, sometimes what I'll say about it is that the problem with depressed people is that they think things and then they make the mistake of actually believing themselves. Mm-hmm. It's why one of the most important skills that you can learn is how to go outside yourself to find out whether what you're thinking, what you're believing is actually true.
Absolutely. The other piece that it was coming to me is also in more societal societies, familial societies, where such as Middle East or Eastern cultures, many of these societies are bound with some particular way of hanging in, not only to the culture, to the religion, aspects that it has to be, to the togetherness, regardless of whether their characters and everything else kind of matches or not. Some of the children, not only due to financial concepts, but just to the matter of, because that's what the society does, they stay with their parents until they get married, and then they don't really individuate in a way that they can find who they are versus who the whole family system is. And it's not only that they can become aware of themselves, but it seems like when they become aware of themselves, they get caught into this aspect of, how do I be a part of a society with a certain type of realm that they are, and the ways that they tell me I have to be, which I no longer want to be. And then if I'm in it and continue being in this way in the society and in the family, I get depressed. And if I let go and kind of rebel against it and move away, then because of the way that the society might react to me, or the way that I've thought about what isolation means, or letting go of my family and all of the other aspects of it, I still go to a depression. Many times I've looked at people in this realm where they find themselves between a rock and a hard place, where as if each one that they go to, they're going to go through a lot of suffering and anguish, and somehow even a total hopelessness for the future. And somehow I also see that being part of the societal pressure that creates the depression in the long term for some individuals.
Well, what you're describing, though, is what I'm wanting to address when I speak about prevention. What you've just described is entirely preventable. Nobody has to first discover in their 20s or 30s how they're getting demotivated or demoralized by the life choices that they feel trapped in now. This is why we most want to teach children how to think critically. What a difference to teach a child how to think versus simply being obedient. And when we've looked at the prevention programs that have worked and worked well, where we go into school systems and we teach children social skills and how to get along with other people without getting overrun by them or losing your boundaries to them, when we teach them social problem solving of how to resolve differences between you and your siblings or you and your parents in ways that are sensible, the opportunities to prevent people from becoming depressed are there. Prevention actually works. We've done it. We've demonstrated it in many, many different contexts. So that self-awareness that's part of critical thinking, to start learning when you're 10 years old, 12 years old, 15 years old, 18 years old, here's what I know about myself, here's what I've learned about myself, here's the kind of environment where I can be, here's the kind of environment that isn't really good for me. Here are the kinds of problems I can anticipate and prevent before they become big issues. And here are the kinds of things that I can actually do something about. And you're not going to change society. You're not going to, but you can learn how to find your place in it. And it's not as if you have to conform to every single standard. That you still have to learn for yourself how you can be productive, how you can be valuable, how you can be a contributor, and still do things in ways that are helpful to you as an individual and help enhance your own quality of life.
And most everything we do, we have benefits and we have costs. And it seems like that awareness of what type of a benefit I'm having with what price. So if I am staying in an environment due to obviously some gain, is that gain worth the other aspects of the depressive state that I get and all the unmanageability that gets created in my life? And maybe the awareness of that piece also makes us make better choices in the way that we are with the choices that we make, whether we are with a group or not, or whether we act in a particular way or not. And maybe that also helps in that way. But something that
what I really like about what you're saying is, to me the important part of what you're saying is that here is how the person takes responsibility for their own life.
Yeah.
And one of the things that we know is a reliable pathway into depression is when you blame other people for the choices that you've made. When you put yourself in the position of defining yourself as a victim, you're lost. I can say in a flat way, nobody overcomes depression by declaring themselves a victim. On the contrary, the way people get out of depression is by learning to take charge of their life, learning to make good decisions. Part of what we've learned, though, is there's a field called affective neuroscience, which is a fancy term for learning something about how people's mood states influence the quality of the decisions that they make. And the problem, of course, is that when people are depressed, they make decisions that are based on their mood, based on the depression, which means they make decisions that actually reinforce and even exacerbate their depression. So anytime that I'm treating someone who's depressed, one of the things I have to look at is the quality of their decision making. How do you learn to make decisions according to something other than your feelings? And how do you make decisions that aren't just based on your mood state? So it's the simplest thing in the world. One of the things that we know, for example, is exercise. Physical exercise is a very good way of countering depression.
Yes.
So when I say to my client, well, it's pretty obvious from all the cobwebs all over you that you don't really move much, and it would really be a good idea for you to start exercising, because exercise helps depression a lot, and it has a lower rate of relapse than medication. So my advice to you is get moving. And the client will say to me, you're right, I should exercise, but I don't feel like it. Well, as soon as you follow your feelings and their depressed feelings, you're going to make bad decisions that make your depression worse. So it's a really important point you raised that I'm now amplifying. Nobody gets over depression by declaring themselves a victim. You've got to take charge of your life, and you got to start making decisions based on what you want and what the outcomes are that are going to be good for you, not how it feels or how easy it is or how comfortable it is. Sometimes the toughest decisions we have to make, they're not easy, they're not comfortable, but they're the right things to do, and they're going to take you someplace better than where you are right now.
And the aspect of, as you said, the responsibility that each person might take on. The accountability of my life is my life, and then I need to do something about my life if I claim that I'm miserable in the state that I'm miserable. I've found myself many times to talk to my client, and when they answer things such as, I don't feel like it, or I'm depressed, I can't get out of it, and the conversation for me is always like, are you enjoying this misery? And if you're really enjoying this misery, then might as well be in it and enjoy your depression, because if you're choosing, and I know nobody ever thinks that I'm choosing depression, and I'm not suggesting that at the beginning we're choosing it, but in somehow, if at one point we're looking at, okay, if I'm not choosing my depression, what are some of the things that I can do to get myself out of it? The same way if I have an illness, I didn't cause maybe the illness, but now that if I can choose to go get treatment or choose not to get treatment, that part becomes a part of my choice. And then how do I get myself out of it is knowing that it's an attitude concept, or it's a thought process and a condition that I need to shift from that generalization and become more reality-based. And the more reality-based I become, maybe less depressed I become, because the reality will take me on, and step by step I move forward with what is in front of me and how I manage it and how I deal with it, versus going into thinking, thought process, and formulas that are not necessarily in reality, and they're figment of my imaginations, and I somehow created this horror story in my head, or a dramatic story in my head, that I consistently go to get entertained in that movie theater inside of my head, and kind of refuse to get out of that movie theater.
Well, it's an interesting thing, because so much of what people focus on when they're treating depression is they focus on the person's motivation. And of course, depression saps motivation. If depression was a commercial product, its slogan would be, "Why bother?"
Yes.
But it's not about motivation. It looks like it's about motivation. But so often, what it's really about is ability. No amount of motivation is going to make up for a lack of ability. I don't care how intensely motivated you are to watch the sunset. If you face east, you're not going to see it. And so what I focus on are the abilities that people have, the skills that they need, the things that they want for themselves that they don't know how to produce. And when I'm interviewing people and I'm talking to them about what they want, and then I talk to them about what the steps are to produce what they want, that's when they find out they have no idea. They don't know what to do next. And so it's easy to say, well, you must enjoy your depression, or you must be getting some benefit from it. But they're not. They don't want to be depressed. They just don't know what else to do about it. And that's really what the value of therapy is to talk to somebody who has more understanding about it, more insight about it, who can focus you in ways that you wouldn't know. All of us have blind spots. All of us have blind spots, things that we don't know, things that we don't understand, things that we don't realize. And too often we don't know what we don't know until somebody comes along and says to us, well, here's what you need to know. And you go, wow, I had no idea. And so to help people start to develop the skills to produce the results that they want, including the skills of how to make decisions according to something other than how you're feeling. And to me, the most important thing about what we're saying right now is getting across the message to people: you're more than your mood. You're more than your mood. Or the people who justify their depression by saying, but yeah, look at all these terrible things that happened to me. Okay, I understand that. These are terrible things that happened to you. But you're also more than your history. You're not your history. You're more than your history.
Absolutely, but there's also this part that I even remember when I was learning from you, and in some essence we were working, and you were working on me. I volunteered constantly to be worked on. And I remember one of the things that I used to say is, I'm constantly getting fat and then go through diets and come back down, and I know. I mean, there isn't anything that I don't know about all aspects of diet and how to keep myself fit and be all of that. And I think my audience, who has been with me for almost 18 years on TV, has looked at me and gone, okay, this woman every couple of years fats up and then comes back and gets skinny, and then goes fat and comes back and gets skinny. And I remember in one of the pieces of hypnosis that you were doing, and what you usually do with hypnosis is first do an interview and look at the patterns of thinking that the person has. And I remember through that interviewing, there was a part of me that held this fantasy. Not the other parts of me did not know that there's a way that if you wanted to maintain, obviously, your health and your beauty and your the look and all of that, is to not eat so many things, and these are the things you don't eat, and you exercise. I mean, I could write a book on that. But another part of me was convinced that I just wanted to be able to eat whatever I wanted and do whatever I wanted to do and have the pleasure that I wanted to have with food. And that's just the way it was going to be. And it wasn't that I didn't know. I knew. From another part of me, I knew. It's just that this part wasn't going to let go of that fantasy. If it was, okay, if I be a good girl and if I actually get my diet and do all of these things, now my reward was going back to my fantasy that, okay, now I've done all the grown-up stuff. I've done all the adult stuff. Now my reward is to go back and just do whatever I wanted to do with food, and I should be okay with this. And I remember part of, then you put everything that you had, we worked with the interviewing, and then you had put it in the hypnosis dialogue for me, and you were, you know, I was under hypnosis, and you were letting me know and talking to me. And one of the things that was a kind of a hit at that moment is like, I know that you want to be a little girl and always stay a little girl, it's just, you're not. And that concept, it's not like I didn't know that I'm not. It's just that a part of me was having some benefit in holding on to that aspect that, you know, as a child, I just want to do whatever I want to do. I knew I was 50 years old and I wasn't a child anymore. But it was very interesting that, yes, you're absolutely right, that at that moment there's still an epiphany of, oh, really? I'm not a child anymore and I can't just eat whatever I want? I know that there's an epiphany in there, but it appears that that part of me was so separated and isolated that didn't have a clue that I was at 50 years of age by now. But I mean, the rest of me knew. So when we're talking about, okay, you know, the person doesn't know.
Well, I would say, here's how I would say it, Foojan. It's the difference between knowing something and realizing something. You know, those are two real different qualities of experience. And, you know, when you come to the realization that how you want things to be is inconsistent with what the goal is, you know, wishing, you know, who doesn't want what they want when they want it? You know, the fact that you want to be able to eat whatever you want in as much a quantity as you want without ever gaining a pound, I understand that. Everybody who's ever been on a diet understands that. But, you know, that's what coming to the realization is that, and likewise when we start talking about people who are depressed, who wish the relationship would be like this, or people who wish their partner would be like that, or they wish the job would be like this, you know, that's great. I understand the wishes. The problem is global thinking over general thinking. You know, there's a wonderful saying, a goal without steps is merely a wish. And that's really the artistry of living well, is how well you can go from a global wish to an actual plan of taking sensible steps that are going to get you where you want to go. Following your feelings isn't what's going to make it happen.
So the other part of, as I hear with you, going through depression and then wanting to treat and get treatment and move forward from depression is first the steps of obviously self-awareness, and then from that self-awareness is also becoming aware of all these parts of you, and after that looking at what is it that you want to create in your life, and the way that you're thinking and feeling and behaving, does that go toward something that you say you want to create, and does it go based on what the environment you live in, and is it workable for yourself and the environment that you're living? And if you can adjust your thinking, feeling, and behaviors toward the goal that is workable for you and others and in the environment, then definitely in that path we're lifting off from, if we are depressed, we're lifting off and we're creating results. And the more that we create the results that we want in our life, then the less anxious and less depressed that we actually become. And then we can hold those results, and because we have the skills and the ability has gotten created, therefore we also have the confidence to keep continuing with those abilities and creating better and better and more results.
Yeah, that was a long summary, and it's accurate, but let's simplify it for listeners a little bit. There's two features here. One is the way that people judge things is according to their own expectations. And what happens when people have unrealistic expectations? What happens when they want and expect this person to be honest and the person isn't? And their expectations are unrealistic for who this person is, and they keep getting hurt by it. Or when people have unrealistic expectations for themselves, that's part of the artistry in life. How do we make sure the real expectations that we have for ourselves, for other people, for circumstances are realistic? That's important. And when we look at how important good relationships are, that the people who are in healthy, positive relationships feel better. And what depressed people do, of course, is they go the other direction. They withdraw, they isolate, they alienate people, they're critical, they're harsh, they're negative. People don't want to be around them. And that's a really important thing to develop the social skills to build the kinds of relationships that are going to give you the support, the attention, the affection, the acknowledgement, all the things that people need that can only happen in social relationships. When we look at the best of humankind, when we look at people's ability to be compassionate, to be empathetic, to be generous, to be self-sacrificing, to be loving, all the things that we think of as being the best of humanity are things that happen in the context of social relationships. And what happens when you don't have the social skills to build good relationships? So that's another key feature of this that we want to make sure, and this is how I would simplify it. Take everything that you said, and all I'm really saying is handling life well requires skill. And if you don't have the skills to handle the different aspects of life that need to be handled, then life is going to chew you up and spit you out. And instead of focusing on your feelings, you get a lot farther by focusing on what are the skills that you don't have that you need to learn if you're going to be able to handle life well.
And I think that one aspect that you said before, that as long as I'm being victimized by some of the results and consistently calling it that it's somebody else's fault, I won't bring myself into the position of looking at what skills I don't have that I need to require and really gain. Because I see that with couples, I see that a lot with schools, I see that with parents, that when the result isn't what they want, instead of looking at what skills do I not have in order to create the result I want, it's usually obviously somebody else's fault that created this result. So it also, as I hear you, takes that essence of awareness and responsibility to take in, to look at the result that I'm not getting as I want to, and then look at the skills that I don't have, and then how do I acquire the skills, and then then I have that, and then move forward with it, right?
Yep. Here's another way of saying it. When the person says, in essence, here's what I'm trying to do, here's the way I'm approaching it, the way I'm approaching it isn't working, that doesn't mean I'm bad, it doesn't mean I'm stupid, it doesn't mean I'm a genetic mutant, it doesn't mean I'm biochemically imbalanced. It means that the strategy that I'm using to try to get this done isn't working. I don't know what else to do, let me talk to somebody else who does. And that's the whole point about, for me, what's called reframing, teaching my depressed clients, the problem isn't you, the problem is the way you're going about it. And as soon as I can teach you a different way of approaching this, one that's more likely to work, that's when life changes.
Yes.
But you don't have to spend time beating yourself up and feeling terrible when you'd be much better off saying to yourself, here's what I'm trying to do, here's the way I'm approaching it, it isn't working, I need to do something else, I don't know what else to do, let me talk to somebody else who does.
Absolutely. Thank you so much. Thank you for being on my show. I always learn from you, whether I was teach, I was learning from you as you were teaching me hypnosis, or at any time that I'm at conferences. When you are with me on the show, I always learn from you. And I want to tell the audience that Dr. Yapko, unfortunately, does not see clients anymore. However, you can go to www.yapko.com, which is on the screen right now. You can see that. You can go to his website, and all of his books are there. And many of his books are written to the public and for the public, especially Depression is Contagious, and many, I think Hand-Me-Downs Blues is also for all of you, so you can read it. And it's fantastic. The books are amazing, and you can follow through and really learn a lot from them. If you like to listen to the other shows that we have had with Dr. Yapko, please go to the YouTube channel that you see right now on the screen and search for the other YouTube ones that we've had on the show. And we've talked about hypnosis and depression before. And Dr. Yapko, thank you for coming to my show. Is there anything else that you would want to say as a wrapping up to everybody who is listening and watching you?
Well, I really appreciate the fact that you make this vehicle available to people to have the opportunity to get some new ideas and some new possibilities. I think it's a wonderful thing that you're doing, and I'm really pleased to be your guest, so thank you.
Thank you. And for all of you, until next week, create a wonderful day and a month and a year and a week and everything. Just create it to be wonderful. See you next week.